Good morning, everyone. This is the Anchorage Assembly's Health Policy Committee. Can you hear me okay?
We can hear you just fine.
Thank you. All right, so we're going to go ahead and call this meeting to order. Ms. Sleppy, will you please call the roll?
Yes, Ms. LaFrance. Is that you, Ms. LaFrance? I heard some garble here.
Yes, I'm here.
Thank you. Ms. Wallace.
Here.
Ms. Allard.
Here. I could barely hear you, though.
Sorry about that. Mr. Dunbar.
He is excused.
Mr. Constant.
He will be here a little late.
And Mr. Rivera.
Present.
Thank you.
Great, thank you so much. So we have 2 items on our agenda today. The first is an Anchorage Health Department update, and the second is a COVID-19 transition update. For the Health Department update, we will turn this over to Director Harris. Thanks.
Wonderful. Thank you so much for the opportunity to talk a little bit about the great work happening here at the Health Department. So as I go through this update, the majority of these activities are related to April in the data associated with April, the month of April, just given the timing of the meetings and receiving this information from department staff. So a couple of things that are happening here at the department in administration. We continue to just be challenged by facility challenges, and the administrative division has really been helping to make sure that there's some resolved situations from the flooding that we've had earlier in the year. We're also looking at have had a failing boiler for some time, so starting the process of trying to get a contractor in to be able to replace that boiler. Really looking forward to that opportunity for just the heart of the organization, or the heart of the building anyways, to have a boiler that's functioning well. Also, human resources is within the administration division, and human resources has been quite busy. And recently we had 15 positions in recruitment, and we continue to just really struggle with filling our nursing positions, nursing supervisor, public health nursing, and our WIC senior family service aide positions. We have been doing a lot of analysis of the turnover at the department, and the health department has the highest turnover rate in the municipality, and our data really continues to highlight the difficulty about our salaries and needing to have more competitive pay rates so that people can stick around a little longer, and we don't have so much turnover and then have challenge of recruiting. So HR has been doing a great job trying to pull together that information and improve the situation wherever possible, and continue the recruitment efforts. In IT and database management, we're looking forward to upgrading our electronic medical records system, which was following approval of a first quarter budget revision item. So thank you for that support. We're excited to move into that opportunity around electronic medical records and updating that system overall. As we look at our grants and contracts team, also quite busy. They submitted 8 different State of Alaska Department of Health and Social Service grant applications, and the department has a lot of grant funding, which requires obviously a lot of support from our grants and contracts team to help move those grants forward to continue to receive the funds within the department. As we look at our fiscal group and team, we're continuing to work on a really large grant, $14 million grant, which is significant for us here at the department around COVID-19 community funding. And that's the bulk of those funds are really to get out into the community to continue to the efforts around vaccine and testing, but has our team focused and working to move that process forward. You guys will also see quite a bit of HUD funding and ESG, CARES Act funds. The fiscal team and our Health and Human Services Division are working on a lot of those funds. Again, trying to get those funds out into the community as quickly as we can, and making sure that those are have good oversight and support as they go out. As we look at animal care and control, through the month of April, there were over 1,000 animals received by animal care and control, and continue to help reunite animals with their owners and get them to adopted families as well. In emergency preparedness, we're having a bit of a shift. We'll talk about that in a little bit around the EOC transition, but the emergency preparedness program and section is really helping in that transition process to move us forward and start to try and get back to some of the emergency preparedness work that has been on hold since we've been in this pandemic, and then in the focused disaster that we've been in over the course of the last year. In the Division of Human Services, as we look at childcare licensing, a lot of support to our childcare licensing facilities to stay up to date on the changes around emergency orders, and as the disaster declaration ended, just really helping to support them to understand what that means for their facilities and continue to encourage the great protective measures that they have put in place over the course of the last year, and really grateful to that team and the relationships that they have with the child care licensing facilities to help walk through that process, and continue to just encourage and support those facilities. As we look at community safety and development, a lot of, we talked about a moment ago around grant funds going out around HUD and ESG, CDBG funds. A lot of their activity has been around the CARES Act funds and getting those out into the community. Also the action plans that you guys have seen recently, the 2020 action plan as well as the 2021 action plan. Again, to get those funds out into our community and working with our partners and providers to have a safer environment for our residents. As we think about housing and homelessness services, they continue to work with the CSD division on those CARES Act funds, as well as working with our partners at United Way around Home for Good, and really working with our coalition, the Coalition End Homelessness, around HMIS, and improving that system and being great partners through that process. And that team is also working on the alcohol tax funds and getting those RFPs developed so that they can get out again to providers. So we look at senior and emergency outreach, where we continue to work with Alzheimer's Resource of Alaska and provide support to our seniors. Last month, we had a lot of really great activities around Awareness Month around seniors and how we can best help our elders in the community. Looking at ASP, the numbers are ticking down just slightly in April. We had 1,055 intakes, which is down from last year. It was 1,174, so a little bit lower in April, and just watching that and helping to support those residents. As we look at the public health division, environmental health services continue to do permitting and inspections and all the great work that the department does in helping to support around COVID mitigation measures as well. But also the team has been working to streamline and support the cottage food license process to make sure that information is easy and accessible, and really trying to work with the Small Business Development Center at UAA to get information out into the community and streamline that process. That team is also wrapping up outcomes around the Plug 20 campaign that we had January through March, and making sure that we have good evaluation of that and thinking about how we can improve that program into the future as well. As we look at WIC, some great information around WIC. Starting in June, women and children are able to increase their vegetable benefits for 4 months anyways. So typically WIC participants get $9 to $11 a month to purchase fresh, frozen, or canned fruits and vegetables. And with the ARPA funds, WIC participants will now be receiving $35 per month for each woman and child participant from June through September. So a significant increase in the access of funds for fruits and vegetables. So the team is working with those enrolled to share that information and help support the purchase of more fruits and vegetables. The caseload for April has increased, 9% increase since July of 2020. So this represents 8 months of increase of participation in the WIC program, which is really exciting. And the team is doing a great job to help support that increased caseload as well. Looking at WIC, the Breastfeed Peer Counseling Program, we have 7 breastfed peer counselor program staff who are providing support to 369 women enrolled in the program. So continue to really encourage and support breastfeeding. As we look at SNAP Ed program, we're continuing to develop partnerships, and one recent one is to facilitate nutrition education with the Anchorage Public Library and the Community Resource Program. So getting back into the library and connecting with them, which is an exciting development and movement forward. And then looking at policy, system, and environment projects, as we know, and hopefully everybody's having the opportunity to visit their local farmers market. The season is here. And so there's a lot of opportunity there around SNAP Ed and WIC outreach and environmental health. And we're connecting with our farmers markets throughout the municipality to offer resources and offer health and nutrition education at the markets. Looking at community health nursing, we continue to do a lot of great work around COVID and really trying to shift back into some of our work that has been on hold or on the back burner anyways, or just not the primary focus during COVID. And so the team is ramping up for planning around HIV testing at different events. June represents Pride Month, and so there's several Pride events and other fairs and opportunities that we're excited to get out into the community and get to share that information. June 27th is National HIV Testing Day as well, and so we'll be promoting that and sharing that information about the importance of people knowing their status and getting access to care and treatment. And then we have our regular boards and commissions meetings coming up. So our Homeless Housing and Neighborhood Development Commission meets today, this afternoon at 4. The Anchorage Women's Commission on the 10th. The Senior Advisory Commission is meeting on the 23rd, and Animal Control Advisory Board will be meeting on the 24th. That's the end of my overview of the great work that's happening here at the health department. And, you know, I think a lot of times our focus is around COVID and kind of the conversations that we're having, but at the health department, we continue to do great work in the community to promote health around all kinds of topics, including COVID. So at this point, I think I'll turn it over to Dr. Johnston, who is going to give us a quick update around COVID and where we are.
Thanks, Heather. So cases have been trending down during the past month, continuing the decline that started at the beginning of April. Over the past 14 days, the average number of new cases reported per day has been 3.7 per 100,000 Anchorage residents, and we haven't seen a case rate this low since the beginning of last July. But it's important to keep in mind that we currently have a split in the population, with about half the population vaccinated and the other half not vaccinated. So what we're really seeing is that most of the risk is in the not vaccinated population, where there's a 14-day average is approximately 6 cases per 100,000 versus less than 1 case per 100,000 in the fully vaccinated. We continue to see hospitalized cases, although at a lower level than in early May. The number of hospitalized patients is currently 14, with 7 of them in the ICU. And over the past week, the number of hospitalized patients has ranged from 10 to 14, and the number in the ICU has ranged from 3 to 7. This sustained level of hospitalized COVID patients, even as the number of cases drop dramatically, may be due to the fact that the patients tend to be younger now. So that these younger patients in their 30s to their 60s have a better chance of survival, but require longer hospital stays. I'm also a little concerned that the dramatic drop in cases may be partly due to reduced testing and identification of more mild cases. But clearly the main reason for the reduction is vaccinations. As of this morning, including vaccines given at JBER, we had 143,050 residents aged 16 or older who have received at least 1 dose of the vaccine, which is the equivalent of 63% of the age 16 plus population. And we have the equivalent of 55% of that population fully vaccinated. Also, we've had 2,856 residents aged 12 to 15 receive their first dose of the Pfizer vaccine, which is approximately 18% of that 12 to 15-year age range. So I'm extremely encouraged that with warmer weather and high availability of vaccines, we could continue to see low cases through the summer. But we want to be careful not to let down our guard. We need to use the summer before people start heading back inside to get more people vaccinated. We continue to see outbreaks in other parts of the country, including in Washington state, and we know that more transmissible variants are spreading rapidly in other parts of the country and the world. So the long-term end of the pandemic is through widespread vaccine coverage in Alaska, but also globally. And that's my report. I'm happy to take any questions.
Great, thank you, Dr. Johnston. Note for the record, at about 10:08, we were joined by members Weddleton and Ms. Kennedy. Are there any questions for Director Harris or Dr. Johnston at this time? You can either wave your hand at me if you're here in person or put yourself in the chat. I did have one question. Director Harris, could you tell me a little bit more about the timing for the RFP development and when we can expect those RFPs to go out with regards to the alcohol tax?
Yes, so those are in development now. We anticipate that those should go out by the early fall. The other thing to know about the alcohol tax funds this year that might look differently into the years in the future is that this year we are also looking at some strategies around doing direct funding to some organizations in some specific scenarios. And so we're really evaluating those options as well. And tying in some of the assembly action and interest for some direct funds associated or from those alcohol tax funds as well. So that may look a little bit different in this first year of alcohol tax than in subsequent years.
Great, thank you. Are there any other questions before we move on to the COVID-19 transition update? Okay, so let's go ahead and move on to that item. I will let either Director Harris or Mr. Dole kick us off. I think we wanted to cover how the COVID-19 emergency operations have transitioned into departments and just understand how that's working. Thanks.
giving a little space for silence if Director Joel is on and wants to start us off. Otherwise, I'm happy to jump in.
Just so we quit waiting for each other. Hi, this is Development Services Director Bob Dole. I'll jump in with what's a pretty quick update. As you know, last month we transitioned away from an incident management team and went back to the functions of vaccine testing and mass shelter being done within the department's Development Services Department, taking on the mass care, mass shelter function. And we've updated about a dozen contracts that was scheduled to expire on May 31st. Using the new process where we do the operational side within Development Services, and Office of Emergency Management does the logistics and the background side. It's been, I think, a pretty successful transition in terms of there's been no disruption in providing the services there. We have made a staff change with Kojin Transberg transitioning out as the mass care branch leader, and Sean Hayes is in that position now. That's the natural transition that's desirable in positions like this. But we're going forward. We're still seeing a strong demand for mass care services. We're working with just the logistics of that and our mission partners and in terms of how to work through those and start lowering the numbers there. Real quick and easy. I'm available for any questions.
Great, thank you. Director Harris, would you like to provide an update on the vaccine and testing side, and then we'll open it up for questions?
Absolutely, happy to do so. So as Director Dole shared, the transition did occur last month, and so just wanted to, at a high level, think about and share what transition means here at the Health Department and our engagement with the Emergency Operations Center. So the EOC remains, but it has moved from a command and control type of structure to a director-driven structure and support. So the Office of Emergency Management is now providing a more supportive role to DSD and to AHD, as we are the ones that have taken on the operations of the work. And as Director Dole shared, testing and vaccine has come over here to the Health Department with mass care over there at DSD. And so as we move into this transition and thought about how we integrated it into the department, there was the option of kind of keeping it separate and having a separate division or space for it. We really wanted to integrate it into the operation, recognizing that while the local emergency declaration is over, the pandemic is still here and will likely be here for some time still, though changing, ever changing. And we do anticipate that it's going to change regularly, as we've seen over the course of the last year, and we want to be able to be nimble and move quickly in that way as well. And so here at the Health Department, we have integrated it into our public health division, into an emerging infectious disease section to do the work of testing and vaccine. And so as we think about, and I guess the other piece is that the vaccine and testing components are very critical around public information and how we communicate with our community, especially around vaccine, as we move into this new phase of vaccine rollout. PIO and external communication is critical to the success in increasing vaccination rates. And so our PIO here at the Health Department is also the lead for all communications around testing and vaccine related activities. And so again, integrating that into the Health Department operation overall and support. So I'd like to talk a little bit about what testing and vaccine looks like now and kind of how we're moving it forward into the future. So I'll start out with testing. So we continue to evaluate the testing usage at the locations currently. You guys are likely very familiar that the facilities currently include the LUSAC Library, Change Point, We have a site in Muldoon, one in Eagle River, and one on Elmore. As we look at evaluating the usage and this changing space, we are looking at closing the Elmore facility that has had really low usage, especially since it moved from the Lake Otis site. It just never really picked up. And so we're always being cognizant of the dollars that are being spent and wanting to use those and steward them well. And so we'll be looking at closing the Elmore facility. And just we'll continue to look at the usage and the need within the community and make adjustments as needed as we move forward. We'll continue to evaluate that testing strategy through the summer and thinking about preparations for the fall. Another shift that's happened around testing is around the around reducing the frequency of surveillance testing, consistent with CDC guidance around assisted living facilities and shelters, and looking at moving that to a once-a-month surveillance testing, unless there is a positive in one of those facilities that would indicate the need for more regular testing. And we would support that process with those facilities as well. Also in line with testing is contact tracing. So we do continue to do contact tracing efforts at this point. We continue to see clusters, and we're providing intensive support to those clusters and really helping to try and contain COVID spread in those types of situations, and just continuing to provide great information to all individuals that do come positive for COVID and making sure to get them the information that they need. It's also really shifting to a space of an opportunity for increased health education. And so we're seeing a little bit of the dynamic change within the contact tracing efforts. But again, as the pandemic moves on, we're going to make sure to be nimble and change with the needs of what we're seeing. So contact tracing at this point is shifting. Then as we look at vaccine and the strategy associated with that, we've been doing a deep dive into our overall vaccine strategy, given where we are right now. And there's a few steps I'd like to just quickly review. We're looking at 4 different steps. The first one around increasing the number of people who want to get vaccinated and decrease the hesitancy and apathy around vaccine. And this is really around the importance of education and getting information. This isn't necessarily trying to change the opinions of those that are clear that they don't want vaccine, but it's helping those that don't have all of the information or are unsure or just hesitant and need more support to make that decision for themselves to get vaccinated or not. Step 2 is really around reducing the barriers to getting vaccinated. We know that there's still a group of individuals in our community that it's hard for us to believe here at the health department and others that think about COVID a lot, but COVID is not the #1 thing on their minds. They might be thinking about the 2 jobs that they have or their many family obligations, and there are these types of barriers in their lives that is making it difficult for them to make getting vaccinated a priority. So step 2 is really about identifying and recognizing the barriers, getting some data associated with that, and then reducing those barriers to help increase our vaccination rates. Step 3 is around continuing to ensure there's a variety of providers and sites and locations and times. We have learned a lot in the course of the last several months that vaccine has been available. There's definitely a need for static pods like we see at the Diamond Center, Northway Mall. They're currently at Blood Bank of Alaska and Dempsey Ice Arena, Shiloh Baptist Church, and Alaska Airlines Center right now, and the Anchorage School District is doing some as well. So the static pod approach is important, but it is shifting. We'll see Alaska Airlines Center close at the end of this month, so July 1, it will be complete there. We want to continue to provide some static pods, but that large push that we saw at the beginning of vaccine rollout looks different at this point. And so we want to make sure to have resources available to shift into different types of of provider opportunities. Those being mobile clinics. We want to make sure that we're focusing on high activity locations. That might look like sporting events or community gatherings, things like that. We're also seeing a shift in some strategy on a national scale that to provide these kind of pop-up quick locations. Really anybody can request that. If there's a large gathering and an individual is interested in having vaccine available at that large gathering, we're happy to go there and get shots in arms quickly. So really wanting to share the information widely about that opportunity where it just may be easier for those, it may reduce that barrier for us to be able to go to the location where maybe a family is gathering or a type of an event or barbecue might be happening. So thinking about mobile clinics, but then also really trying to increase and strengthen our healthcare provider settings. We've had great engagement from many providers in the community in providing vaccine early in the pandemic. There's still likely some providers that are hesitant about jumping into providing vaccine because maybe they have old information about it being a little more difficult or how they're going to handle waste, things like that. And so we'll continue to lean into the space of really trying to increase and strengthen the healthcare provider setting so that there's more support and ability for vaccine. And then the final step is around step 4, which is around evaluation and surveillance. And so as we walk through these steps and think about vaccine, we really want to understand what strategies are working and where there's potential for change and continue to really learn from the data. Specifically, also, we're seeing some special populations and the importance of focusing on those. Specifically, 12 to 15-year-olds were the group that were most recently able to have access to vaccine and eligible. So we're thinking about that population of individuals and what their needs might be. We're also seeing that young adults are less likely right now to get a vaccine, though we are seeing an increase in the percentage of cases in young adults. So really trying to kind of dive into that space and think about how to communicate well with that population of people, as well as those that are incarcerated and those disproportionately affected by COVID. And then finally, within that evaluation and surveillance and just recognizing kind of our next steps, thinking about the fall of 2021 into the summer of 2022 and recognizing that younger children will likely have access to vaccine. And there's some conversation about the need around booster shots and when that might be needed. So we're working through plans to be prepared for when that might come. So that's
Great.
a little bit of
Thank
an
you.
overview. Yeah.
So I want to invite members for questions at this time. I have 2. The first one is for both Director Dole and Director Harris. Are we still planning, as the operations were explained, that these would persist through September? And the second question is for Director Harris. Is there sufficient infrastructure in place with how we've transitioned into the health department if we do need to do booster vaccinations or the vaccine is approved for a younger population like the under 12 age group? Thanks.
Yes, so happy to start, and then I'll turn over to Director Dole around if we anticipate these efforts going through September. From a health department perspective, I would say yes. We anticipate this work continuing through September. What it looks like and how it's funded into the future is likely to change. I think with many of the things around the pandemic, it's an ever-changing world, and so we are tracking that, but I do anticipate continuing to be working on COVID-related items, vaccine and testing, definitely through September.
Hi, this is Director Dole. For the mass care side, we clearly envision that we will have operations going on through September. and our focus being beyond that where we start drawing down.
Great, thank you.
And
Any
then to your other question about sufficient infrastructure, I mean, I'd say our goal of integrating into the department was so that we could be nimble, and we've had plans in place even prior to COVID around, you know, how we would stand up a mass vaccination pod, which a lot of those plans can be used in thinking about the booster shots or those types of things that we might need in the future. And we've just learned an incredible amount over the last year. So we're really trying to take that information, have it accessible within the department so that we can be ready and make sure that we have the proper facilities that might be facilities and other, you know, support that might be needed to stand up a mass pod for a booster or something of that nature. But there may be different ways of how this rolls out as well. It may be a more phased kind of approach of how people get boosters. We just don't know that guidance yet. So we're just standing ready and preparing for whichever direction it might go.
Great, thank you. We also have with us Amanda Loach, who is the Director of the Office of Emergency Management. Ms. Loach, would you like to share anything about the COVID-19 transition as it's working into your standard or regular operations? Ms. Loach, are you with us?
I am trying to. Can you hear me, ma'am?
Great, thank you. Yes.
Hi, good morning. So my name is Amanda Loach. I'm with the Office of Emergency Management. As far as the transition goes, I just wanted to share that we are continuing to support at the Emergency Operations Center. We have just completed a plan that we call the Incident Action Plan, a process that we've been utilizing throughout this disaster through July 3rd. And we will continue doing plans to, as we move forward with lessons learned and improvement planning, like Heather Harris was talking about, as we move forward over the course of the disaster. We will have to change our operations, including some of the demobilization that Mr. Dole was talking about in regards to mass care. So we've also continued forward with the work that we are doing for cost recovery through FEMA's Public Assistance Program. So we have a lot of plans and operations to support the team as the disaster evolves. If anyone has any questions, I'd be happy to answer them.
Great. I'm not seeing any questions at this time, but before we move on, I'll make a last call for questions with regard to the COVID-19 transition update. Okay, well, thank you to, oh, I'm sorry. Yes, Ms. LaFrance, please go ahead.
Thank you, Madam Chair. Two questions, and I believe both are for Director Harris, and thank you all for the update on the transition plan. Very much appreciate the information. Just on the testing numbers and the likely closure of Elmore, and that will leave 4 other sites. Could you just talk about the testing numbers and demographics? Are those, if you have demographics to share, if those are primarily Anchorage residents, or if you see people, you know, and I'm not sure, again, if you have this information, who are visiting, who are getting tested. Just curious on the demographics and that trending. And then the second question is somewhat tangential and has to do with the hospitalizations and cases, particularly among younger people, and longer hospital stays, which if people don't have insurance are very costly. And I know too that as people recover from COVID, sometimes there are post-hospital medical expenses as well. And I don't know if you have information on this, but I'm wondering about the impact on any of our local residents, these COVID-related medical costs. And perhaps there are, federal relief funds available for that. But I was just curious if you could comment on that piece too. Thank you, Madam Chair.
Absolutely. So first, on the testing demographics, that I was actually part of our conversation just late yesterday to get some more clarity about where those individuals live. Specifically, as we think about, Eagle River location, are those Valley residents that it's easy to kind of slide in, or are, thinking about some of our Muldoon sites, are there, or any of the other sites, are there Eagle River residents that are still able to access some of these other sites as they go to maybe work or shopping or wherever they might be. And so we are interested in that kind of movement of individuals and where they live and which site they're maybe going to, and what seems to be just the most accessible to them. And so I don't have that information offhand, but I do, I think that we do have it somewhere, as we were talking about it yesterday and trying to see if that is, that's a data point that we can evaluate as we make decisions about the future of these 4 remaining sites. And so I'm happy to follow back up with you on that as we get that information or whatever information we are able to share. I don't have a more comprehensive answer for that right now, though, but happy to follow up. Yeah, absolutely. And then around thinking about hospitalization and younger population, I think I'll turn it to Dr. Johnston in a moment. We do know that those that are hospitalized or being hospitalized at this point are absolutely the majority of those individuals are unvaccinated residents. And so this just highlights again the importance of vaccine and the ability to stay out of the hospital and stay away from, as a vaccinated individual, you're at much lower risk for this severe illness. And we are also really thinking about how to communicate to that younger demographic about the importance of getting tested and recognizing the medical costs that it really can be to those individuals and how detrimental that can be, while trying to really message that in a way that's not a scare tactic, but is informative and supportive. So to help them make the right decision for themselves. But Dr. Johnston, would you add more to that? I know that this has been a bit of a conversation on a national scale and potentially locally as well.
Right. I mean, I don't know much about funds that are available to help pay for it. The big push at this point is to help people understand that to avoid the hospitalizations and associated costs, that vaccination is the best approach. The other thing that we know is that people who become infected, even if they're not hospitalized originally, are more likely to see their health provider in the 6 months after they're infected. So there's clearly a potential medical cost associated with COVID. But I think it's something that the costs are just covered the same way that, other illnesses would be covered at this point, unless your insurance has something, a special case for COVID. And I'm just not an expert on that side of it.
Thank you. And thank you, Madam Chair.
Great, thank you. So we're going to move on to the next item in our agenda, which are legislative and budget priorities. Did anybody have anything they would like to raise? I did not have anything specific at this moment. Okay. It is that time of year where there may not be budget priorities quite yet. So turning next to audience participation, do we have anyone who would like to participate today? Okay, I am not seeing or hearing from anyone. Anything else from the committee before we adjourn? All right, well, thank you to Director Harris, Director Dole, Ms. Loach, and Dr. Johnston for joining us today and providing those comprehensive updates. And with that, we will be adjourned. Thank you so much.